Good evening, ladies. The title for the session tonight is HRT, is it good or bad? And I have to say that came from a question that was asked by a patient last week. And I thought it was a great question because at the end of the day, that's what it comes down to. Is it good or is it bad? So what I really want to do tonight, I want to give you some scientific information and some facts that you need to know when you're evaluating your decision in relation to HRT. Because that's what we're supposed to do when we make a decision. We're supposed to have all the facts in front of us so that we can make a balanced decision. And unfortunately, in relation to HRT, there is a lot of misinformation. It was very interesting during the week to see the debate that went on the page under the poster that advertised the talk. And people were saying it's really good. Some people were saying it's really bad. And obviously everybody had an opinion on it. But when you have to make a decision, you don't need opinions, you need scientific facts. The press has not been really good to HRT, and unfortunately we have had very bad titles in the past coming out with things like HRT gives you breast cancer, which has pushed a lot of women into fear of taking the medication. And I'm sorry for all the journalists out there, but this hasn't really helped. So what I say to women is when you're looking at your information, be really careful when you get the information from. And unfortunately, the press is not usually the best place to go for medical facts. And before I forget, I want you to write down this website, which is menopauseMatters.co.uk. It's an official site for the British Menopause Society, and a lot of the facts and information I'm going to give you tonight are given in that website as well. So, what are the good things and what are the bad things about HRT? So why should you take HRT? The first reason to take HRT is symptoms. So if you have symptoms, you usually think about taking it. And as I said before, I usually narrow down the symptoms for my patients to 4 symptoms, which are the ones that really affect your quality of life. They are the hot flashes and night sweats. They are the inability to sleep, sometimes because of the night sweats, sometimes for no reason whatsoever. Being constantly chronically tired, sometimes because you don't sleep, sometimes just because you are tired. I have women who tell me that they have difficulties in getting out of bed in the morning, even if they slept all night. And the fourth one, the fourth important symptom, is the changes in mood. And that includes things like anxiety, depression and sadness. Sometimes it's really the inability to cope with work and what goes on at work or what goes on at home with your family. All these things are due to lack of estrogen. And if you do decide to take HRT, they all get better very quickly. Now, what I always say to my patients is they get better if they're due to lack of estrogen. So if you hate your job, if you have problems in your marriage, if things are not good at home, these things are not going to dramatically improve just because you take HRT. Okay? And what I do see in practice is that very often women struggle for a very, very long time before deciding to take HRT. So they tried everything under the sun first, and then eventually sometimes they end up taking HRT. And it doesn't really have to be that way. HRT can be your first choice if it's the right choice for you. Now, so symptom is number 1, but the other important things to keep into consideration when we talk about HRT is the long-term benefits of taking HRT. And this is something that not many women are aware of. And this is something that a lot of women who decide not to take HRT don't really put into consideration. So, what are the long-term benefits? There are 3 major things that will happen to you when you go into menopause. The first thing is that as your estrogen level goes down, your risk of cardiovascular disease goes up. We don't do really badly in terms of heart attack in comparison to men up to the age of 50. And then after the age of 50, we catch up with men and our risk of heart attack goes up. And there is good evidence that if you take HRT early menopause, you can reduce your risk of cardiovascular disease. Is that important? Very much so, because risk of cardiovascular disease kills about 50% of women. So we're all worried about breast cancer, but half of you, 50% of you, will actually die of heart disease. breast cancer will only kill 3% of women. Okay, so I don't know why people don't worry so much about the heart, but it's a very important issue. Number two problem in the long term is your bones. You've all heard about the disease called osteoporosis, which is when your bones become a bit weaker and you can get fractures. And osteoporosis is worse in women in comparison to men because of the lack of estrogen. So again, it is something that if you take estrogen, early menopause can be reduced and your risk can go down. A lot of women don't worry about osteoporosis. It's not very scary. We worry a lot about cancer, and osteoporosis doesn't look as bad. But believe me, if you have osteoporosis, life is not good. It can mean to have chronic pain, it can mean not to be independent, and it can really make the difference between being at home and being independent and being in a nursing home and having to have assisted accommodation. So there's no really much point in living longer if the quality of life is not that good. And 1 in 2 women in Ireland will suffer a fracture from osteoporosis at some stage of their life. So again, it's a very, very common and important issue. And problem number 3 is your vagina and bladder. All women at some stage in menopause, usually this happens towards the end of your 50s, will develop a condition called vulvovaginal atrophy. And what that is that your vaginal mucosa changes, it becomes much more delicate, and in practical terms what it means to have pain when you have sex, it means to have chronic vaginal infections, it means to have recurrent urinary infection, or being sore and being itching all the time. So it is really important part of your life as well. And the reason why I want you to remember these very 3 important long-term effects is that if you decide to take HRT, somewhere along the line, you will meet somebody who will say to you, stop taking that is not good for you. And you need to remember why you made the decision in the first place. So it's really important that you are really conscious of the fact that the long-term benefits of HRT should certainly be part of your decision. Okay? So, if it was so easy, if everything was so good, why does not everybody take it? There are obviously a couple of problems that can happen with HRT as well. The first one is that your breast cancer risk goes up. Now, it doesn't go up a lot, and the quantified risk is that you will have 3 to 4 extra cases per 1,000 women who will develop breast cancer if they take HRT. But HRT is a multifactorial disease. So I want you to look at this tablet here that we use to explain breast cancer to women. And this is from the British Menopausal Society, which I was quoting earlier on. You can see the first line up are the women who don't take HRT. And in the second line, you have your 4 extra cases due to women, of women who do take HRT. But look at the line just below, just 3 lines below, which is the line of women who drink more than 2 units per alcohol per day. It's actually greater risk than taking HRT. And look at the second last line there, which is the women who women who have a problem with the weight. Obesity is a much more bigger problem than HRT in terms of breast cancer. And then if you look at the last line there, which is the women who exercise, the yellow people are the negative, so they are the less cases of breast cancer. You see how much is reduced in women who exercise half an hour a day. So what I say to my patient is, take your HRT if you need it, exercise half an hour a day, and you end up with line number 1 because that's how maths works. Another way to look at number is this. In women who don't take HRT, 12 women out of 1,000 will develop breast cancer. That also means that 988 women don't get it. And in the group of women who take HRT, your 3 cases mean that 985 women don't get it. So you see why numbers are important. It's not as simple as saying HRT gives you breast cancer. It's far more complicated. And on the other hand, as I said before, you have to remember that you have a decent quality of life because you don't have your symptom, you have decreased your risk of cardiovascular disease, and you have reduced your risk of osteoporosis. So for each one of you, it is a matter of balance. That's what I usually show my patients when we're trying to make a decision. You have a balance and you need to put your pros and cons on this scale to decide what you need to do, because the decision of taking or not HRT will be different for each one of you. Now, The second little problem that you can have with HRT is that there is an increased risk of thrombosis. That means to have blood clots. So it's either DVTs or pulmonary embolism, which can be quite serious. But the risk is quite small. And again, there are a lot of factors that affect this risk. It depends if you're overweight, if you smoke, or what your personal and family risk is. And there are ways that we have to reduce your risk of thrombosis depending which medication we give you. For example, if we put you on a patch, which is another form of HRT, your risk of thrombosis is not increased at all. So that's one thing that we take into consideration when picking the right medication for you. So let's say that you decide not to take HRT. So these are all the good and the bad things. Let's say that you decide not to take HRT. What do you do then? Or, for example, you can't take HRT because you've had breast cancer yourself. So in relation to symptoms, we can help with other medications. I'm not going into the details of that because it's a little bit more complicated. We don't have one medication that can fix all the symptoms, but there are ways to treat symptoms even if you decide not to take HRT. But what you need to do, especially if you decide not to take HRT, is you need to think about what your plan B is for cardiovascular risk and for osteoporosis. And that's what I usually ask my patients to do. What is your plan B? What are you going to do to reduce your risk? What is your weight? What's your cholesterol? What's the family risk of cardiovascular disease? And try to make a plan with them on which way are they going to reduce their risk. And in relation to osteoporosis, you definitely need to have a plan B, which is very possible. In relation to osteoporosis, exercise will be your weapon number one. And the exercise that it is recommended to reduce bone risk is resistance exercise. A lot of women think that walking is good, and it's true, it is very good for you, but it's not enough for your bones. If you want to reduce your risk of fractures, you need to do resistance exercise. And that includes things like lifting weights, doing strengthening classes. Yoga and Pilates are very good. I particularly like yoga because you can achieve your strength and also increase your flexibility at the same time. So that's what is a plan B could look like if you decide that you don't want to take HRT. That's basically it, guys. These are the bad and good things. There is not really much more you need to know about the facts. That's what you need to make your decision. Now, before I address some of the questions that I got during the week, I want to make a little comment on some of the comments that were made on the website under the poster that advertised the talk. Because there were some women saying it's good, some women were saying bad, but there are some women telling other women, don't touch that medication, that is really dangerous for you. Now, we're all entitled to our opinion, and we're all entitled to make our own medical choices. But when you're telling another woman, don't take that medication, what you're actually doing is you're giving medical advice. And you're giving medical advice to a woman that you know nothing about, because you don't know her risk of cardiovascular disease, you don't know her risk of osteoporosis, and you also don't know her severity of symptoms. You have your story and your own experience, but it could possibly be that her symptoms are much worse than the one you had. And if you're the one taking the advice, you really should think about where the advice is coming from. Is this a reputable source of information, or is just somebody telling me to do something and they probably know as much as I know, or maybe even less? Okay, so we all have our opinion, but let's be kind to each other and let's make sure that the information comes from a reputable source. Now, and this is particularly important because this type of scaremongering is what has pushed a lot of women in making the wrong medical decision, and I personally don't think is right.